Mr. Patrick. Hey, I'm Dr. Choi. What brings you in today?
I was looking for Dr. Ethan Choi. Is that you?
Yeah. And why are you looking for me specifically?
Do you recall seeing my wife here a year ago? Megan Patrick?
Sorry, not off the top of my head. Why?
Because you're the doctor that killed her? I don't care what you remember. Just give me the facts.
I understand. But first, I just want you to know that I realize you've been through something truly awful.
Sit down. Just tell me what happened.
Okay, Mr. Patrick. But I have to look up her chart.
Gregory.
Your wife was given antihistamine steroids and epinephrine, but progressed to cardiac arrest. I performed CPR with ACLS for 35 minutes, but she never regained circulation. And at 9:17, she was pronounced dead. Mr. Patrick, I assure you we did everything we could.
No!
I can only imagine the pain you felt.
She couldn't breathe. Do you know what that's like? I want you to know how it feels. This is your...
Mr. Patrick! There's a toxic spill. Evacuate the ED now!
Code orange! Everyone out right now! Get your patients out right now! Code orange!
Get out! Everybody out! Go, move!
This is Maggie Lockwood. Toxic exposure to ED. I repeat, toxic exposure to ED. Get the hospital on bypass right now. Start the internal disaster protocol. Everyone out now! Move! Move!
Move! Move! Move! Everybody out!
Moving out the truck!
Head trauma, GCS-9. We just got her, so she needs a full trauma workup when you land.
35% TBSA, second and third degree burns. Take him straight to the burn center. Maggie!
Yeah.
Have you seen Natalie?
Don't worry, I saw her take the patient upstairs before the spill. Dr. Choi? You need to sit down.
I'm okay. But we have more patients in ambulances, so we need to triage into red, yellow, and green and get the sickest ones off in the first wave. Make sure everyone's showered and decon.
You got it.
Come on, stay through here. About to head to the station.
How long till you could detox my ED?
Depends on the floor plan, ventilation, size of spill. I'm sending squad in now.
As soon as they get us the samples, we'll take them down to the lab and try and ID the toxin.
And what about Mr. Patrick?
We're looking into him now, background, employment, family, anything that'll give us a lead.
We already have 12 hospital staff and patients in respiratory distress. We need to figure this out, and fast.
Got it.
Guys, I gotta go.
Ethan, breathe.
Ethan? Talk to me, Ethan. Talk to me.
Get him on O2!
Mask! Here you go.
Ethan!
Ethan.
Hang in there, Ethan.
How's he doing?
Not good.
We'll get him through this.
He was trying to keep me safe. Back there in the ED, that's why he didn't let me in the room.
Yeah.
Please tell me you found something.
Jacob Patrick is an engineer at a textile factory. He has access to numerous industrial toxins. We're hoping to have it narrowed down soon.
Please keep me posted.
I will.
You can't be serious.
Until an ambulance shows up with more, there's nothing we can do.
What's going on?
Ethan and Mr. Patrick are both in bronchospasm and in need of racemic epi. The problem is there's only one dose left.
Which obviously we should give to Ethan.
Who's doing worse?
That's the thing, Mr. Patrick is.
You're not really thinking of giving it to him.
I'm following protocol, April. Whichever patient has the greatest need gets treated first.
He came here on a suicide mission.
I'm sorry.
Give Mr. Patrick the epi.
This is wrong.
All right, guys inside check. They can't find any more doses of racemic epi.
We have to do something. His airway's almost closed.
I mean, we could try methylprednisolone. It's not great, but it's better than nothing.
Okay, where can they find it?
In the respiratory therapist carts.
All right, what does that cart look like?
We're wasting time.
April!
Hey, you can't go in there!
Give it to him now.
That was incredibly stupid. Let's hope this works.
All right, come on. Let's get you decontaminated.
PD's narrowed down the possible toxins. We hope to have an answer soon. Look, I understand you're upset, April.
Ethan is dying. And you didn't fight for him.
I did what I was obligated to do. And Dr. Choi would have done the same thing.
Yes, sir. Any changes?
Nothing.
All right, keep him going. Word is we should have an ID on the toxin soon.
He's at VFib. April, start compressions. I need these cuffs off. Monique, charge at 200. Back. Clear. Continue compressions, charge again. Clear.
Still no pulse.
Charge again. Clear.
Continue compression.
No, he's gone. Time of death, 12:12.
They identified the toxin. It's cyanide.
Oh, God. Ethan.
Okay, let's go, everyone. Let's go. We got the all clear. Let's get everyone inside. All affected staff go to trauma 2 and 3, and we'll triage from there. Let's go.
Give a dose to everyone who's affected.
What is it?
Hydroxycobalamin. It helps counteract the cyanide. I got the hydroxycobalamin. Think it'll work?
As you know, there's no antidote to cyanide. But it's the best chance we got.
We've got a room for him in ICU. We're moving him upstairs. I'll make sure they call if anything changes.
Thank you. Miss Goodwin, you were right. He would have done the same thing. His pressure's going up. I think the medicine's working.
All right, get him upstairs.
Keegan and I have been neighbors for a few months since I moved back.
I'm only here because Vicky talked me into it. At this point, I've given up on doctors.
Whoa, no. No more scratching.
I can't help it. It's been 3 years. 3 years never stops.
And it started with a MRSA infection.
The antibiotics to treat it.
Linezolid. Side effect was pruritus.
Bad itch, huh?
The worst. Everywhere. And I mean everywhere.
But the reaction went away when she stopped taking the pills.
Except for right here, and it is killing me not to scratch it right now.
Itch never lets up. In the shower, when you're sleeping?
Never. I've used toothbrushes, pencils, even steel wool once. Nothing stops the itch.
Easy.
Stop,
Keegan,
stop, stop,
Keegan.
stop.
I know it's hard. Just try not to scratch.
All right, I'm gonna clean it out and apply some steroid cream. Should help calm it down.
That won't do anything. I've tried creams and antihistamines, acupuncture. I've seen dozens of doctors, dermatologists, allergists. Nothing helps. I just can't stop.
Don't. Doesn't that hurt?
All I feel is the itch. It's all day, every day. Please just find it and cut it out.
Okay. Let's get a full set of labs and go from there.
Keegan, I'm Dr. Charles. How you doing?
Of course, the shrink. Look, this isn't because of feelings, and it's not OCD. I don't have delusional parasitosis or conversion disorder. The itching didn't start after my dad died or my boyfriend left me. Look, I'm not insane. My head just itches, and I want it to stop.
Okay. Well, let's try and make that happen.
Really? Usually, docs are writing me a referral, so I'll leave.
Well, you came to us for help, so we're gonna help you. Just for now, though, you think you'd keep your hand away from the wound?
Can't help it.
Okay. So Dr. Choi told me that you've tried OTCs, prescriptions, host of home remedies. How about bupivacaine?
What's that?
A local anesthetic.
5 mil should do it. I'd like to apply a little bit to the area. If it provides relief, it would suggest that the problem might lie in your cutaneous nerve endings, and that would help suggest a treatment plan going forward.
Then stop talking and get to it.
You're gonna feel a pinch.
Do it. Ooh. Okay. It feels different.
Different how?
Better. I mean, it tingles a little, but it itches less.
It's a good start.
Yeah. We'll check on you in a bit.
So anesthetic should provide relief for like 3 or 4 hours. Itch doesn't come back. Set her up with some topical patches to take home.
Sounds good.
Damn it! Ah!
Call Dr. Charles. Keegan, stop. Don't scratch.
Oh, the itch's back and it's worse than before.
You have to stop scratching.
Oh, and then you have to tie me down.
5 milligrams of diazepam.
On it. I can't live like this anymore. I'd rather be dead.
What happened?
Oh, God. She scratched through to her skull.
That's a new one. Usually I have to cut them open myself to get to the brain.
So what do you think?
Well, for whatever reason, the cutaneous nerves in that part of her scalp went haywire. It makes them always feel itchy, so she keeps scratching.
Better fix?
Yeah, surgery. Sever the nerve. No more feeling, no more itching.
And no more scratching.
Yeah, and possible serious irreversible side effects. Facial paralysis, blurred vision, worst case, she ends up in a wheelchair.
I'm not cutting her open in an alley, Daniel. The risks you're describing are dwarfed by the reward.
Yeah, we hope.
What do you suggest? Twice a week counseling sessions? Of course, we had to put a cone around her neck to keep her from scratching.
Sam, all those years of scratching, those nerves are shot. There's nothing left to go haywire.
Dr. Charles, if that were the case, Keegan shouldn't feel anything, let alone an itch.
If those nerves were active, that anesthetic would have provided relief for hours. It didn't.
You only used 5 mil. It wasn't enough.
I agree. The anesthetic didn't work for long, but it did work. Proves the nerves are involved.
Great, we have a majority. Not that I care. We done?
Sam, all I'm saying, I don't think operating's gonna do a damn thing.
Thanks for your input, but the last time I checked, I was the neurosurgeon. Put her on the schedule.
Isn't surgery supposed to be the last option?
Dr. Charles, she scratched into her skull. What's all this?
It's an experiment.
For what?
Well, you don't think that Keegan can experience her itch without cutaneous nerves, and I do. I think I can prove it. Have a seat.
Okay.
So, can you take your left arm and put it on the other side of the partition here? Thank you.
So that's like a magic trick?
Yeah, kinda. Okay, so I'm gonna start to brush your real hand and the fake hand simultaneously, but I just want you to look at the fake hand, okay?
Whatever you say.
So, amputees sometimes still feel the missing limb, right?
Yeah, a phantom limb. The nerves are transmitting confusing signals.
Or do amputees still feel missing limbs because the brain is just assuming that it's still there? Because if that were the case, the nerves would be irrelevant, right?
So you're suggesting Keegan's got a phantom itch? Her brain is telling her it's there even though it isn't?
Yeah. Just like amputees perceive a limb that used to be there, Keegan still perceives an itch that she got 3 years ago from a drug reaction, when the brain is basically playing a trick on her.
Interesting theory. Where are you going with all this?
That's not your hand, right? But the more you stare at it while feeling me brush your real hand, the more your brain might start to blend them together.
I guess I can buy that.
Yeah. Very powerful, the connection between what we see and what we feel.
But Dr. Charles, I still know which one's my arm.
Huh. Do you?
For a second there,
You felt the hammer?
Yeah, I did.
Well, and we both know there aren't any nerve endings in this thing, right? Amazing the tricks the brain can play on us.
Keegan, wait! I've changed my mind. I don't think you should have surgery just yet.
Oh, here we go. What crazy ideas Dr. Charles talked you into?
It may not be a nerve problem. It could be a perception problem.
In fact, I'm not sure your itch is real.
Not real? Are you too serious?
Look at me. I have to be tied to the bed so I don't scratch a bigger hole in my head. If surgery will work, I have to do it.
But what if it doesn't? What if you wake up and nothing's changed?
It has to work. Because I can't live like this anymore. I want my life back.
Surgery will give it to you. All right, let's go.
Hey, Keegan, wait. The brain can change in response to experience. It's called neuroplasticity. 3 years ago, a drug reaction created a chronic itch that you can't seem to satisfy because it rewired your brain. No surgery is going to fix that, trust me.
Daniel.
Please, Keegan, let me try something before you go into the knife.
It's been 3 years. What can you do for me that no other doctor has tried?
A trick.
What do I do? I don't know how long I can go without scratching.
Okay, I want you to look at your reflection and scratch the non-itchy side of your head. In the mirror, the image is going to be reversed. It's going to look like you're actually scratching the itchy side.
Oh, I see it. But how is scratching this side of my head going to make the itch go away on the other side?
Keegan, trust me, we know that you've been feeling this thing, but I just want you to consider the possibility that maybe, just maybe, that this itch isn't real, and no amount of scratching is going to satisfy it.
Well, then what the hell am I doing?
Giving your brain new visual input to override the experience you had 3 years ago so it can begin to rewire itself.
Okay, look, you're losing me.
By feeling yourself scratch one side of your head while you're seeing yourself scratch the other, your brain will be tricked and realize something's not right. Now, hopefully, that experience will force you to perceive a new reality.
A reality in which the itch doesn't exist.
So you say, but nothing's changing. And I feel stupid.
The exercise is designed to confuse your brain, so don't worry about that. Just keep scratching.
Like this? Harder? Softer?
Just like you're doing. Be patient. Okay, give it a chance.
Keegan will be just outside.
You're doing great.
How long are we gonna let her keep scratching?
She's been dealing with this for what, 3 years? I mean, honestly, Ethan, I don't know how long it might take.
If it takes. The phantom itch theory makes sense, but it's still just a theory.
Certainly don't want to give her any false hope.
Dr. Charles, something's definitely happening. The itch, it's less.
Good morning, Mr. Kaminsky. Hi, I'm Dr. Choi, and this is student Dr. McNeil. Hi. I understand you're experiencing some palpitations in your chest. How about you unbutton your shirt so I can take a listen?
Sure.
I see we already took your blood pressure.
226 over 117.
That's high, isn't it? A lot higher than I like to see it, yes. All right, take a deep breath for me. And exhale. Then another. Exhale. Bilateral crackles with mild bronchi.
That didn't sound good.
Not time to panic yet, but it's good you came in. I want to run a few tests and give you something to bring down that blood pressure. Excuse me. Hey, Hank. Start an IV and give 20 labetalol, please.
Absolutely.
Let's get a CBC, CMP, troponins, and set them up with an EKG and renal ultrasound.
Okay.
Hey, Hank. Everything all right? Where you going?
Is he okay?
I'm sure it's nothing. Terry, clean this up and let's get that IV started.
All right.
It's okay.
Hey. What's going on?
Choi,
Yeah.
I just checked in on Mr. Kaminsky. Nurses still haven't drawn blood or sent him up for scans.
What are they waiting for?
Don't know. Can't get a straight answer. Want me to do it?
No, I'll handle this. Hey, why is nobody filling the orders for my patient in 5?
Got busy.
I need that workup now. Will you do it, please?
Sorry, gotta give Stat Night Shadow treatment too.
April. Doris, I need you to draw blood in 5.
I'm sorry, I'm on a break. I gotta clock out.
Draw Mr. Kaminsky's blood first, so don't bother clocking back in. Mags.
Yeah.
You gotta rein in your nurses. They're dropping the ball on my patient in 5.
Dr. Choi, we're down a nurse. We'll get to him.
Ow! Ow!
What's wrong?
She's hurting me.
His veins are impossible and he keeps moving. Stay still.
Ow! Stop stabbing me.
Doris.
There we go. All done.
Suddenly don't know your way around a rolling vein?
That was a hard stick. I gotta run this to the lab.
Mo, talk to me. What happened with Hank today?
Nothing. He wasn't feeling good.
Monique,
You have to ask April.
I'm asking you. We're talking about patient care here. This is serious, all right? Monique.
Your patient's a child molester. He was Hank's piano teacher. He raped him when he was a little boy.
Please tell me this wasn't your idea.
What?
You know how unethical it is denying a patient care. Treat him like a pincushion. I should write you all up for what you've been doing.
Do you know what that guy did to Hank? He molested him, Ethan. Regularly. During their piano lessons.
It's terrible. I know. But it's not up to us to dole out justice. Hank should call PD, press charges.
He did already. But it was Hank's word against Kaminsky's, and the judge dismissed the whole thing before it even went to trial. Yeah. And since Kaminsky wasn't even convicted, he's not registered as a sex offender. For all we know, he's still doing this to other little boys.
Look, I get why this upsets you. It upsets me too. But regardless of how awful this patient might be, we have an ethical obligation to treat him as we would anyone else.
Fine. But there's nothing that says we have to make his stay a vacation. He will get the bare minimum from me.
Look, if that's how you feel, maybe it's better you keep away altogether.
No problem.
Mr. Kaminsky's EKG and scans are done.
Your labs came back negative. I'm not seeing any tumors or lesions.
That's good, right? Can I go home now?
You'll need to follow up with the primary care physician, but it looks like you're responding to the labetalol we gave you, so hopefully we can discharge you soon.
Thank you.
One last thing. I didn't ask you earlier, but hypertension can often be made worse by things like work-related stress.
That wouldn't apply to me because I've always loved my job.
What's that?
I teach piano at my house for over 30 years now.
You have a lot of students?
Enough to keep me occupied.
Pressure drop.
No pulses in V-fib. Terry, start compressions. Doesn't make any sense. He was fine 5 minutes ago. That you're staying away from this patient.
He pushed the call button. No one else was around.
Charge 200.
Charged.
Clear.
Still in VFib.
Push 1 milligram of epi. Charging 200 again.
Charged.
Clear.
He's asystole. I think he's gone. Dr. Choi.
Time of death, 1442.
Not sure what I'm missing here, Dr. Choi. The patient responded to the labetalol, so how do you have a massive cardiac event out of the blue?
I'm not sure.
I know they're pretty rare, but at first I thought maybe a pheochromocytoma was responsible for spiking his BP, but I don't see any tumors on these scans. There must have been some other factor at play, right?
How many doses of epi did we give Kaminsky when he died?
According to the case notes, 1 before he went asystolic. Why?
There's 4 empty amps in the trash.
Really? How could that be?
Follow the body down to the morgue, find Dr. Shore, and ask her if she could tell me how much epinephrine Kaminsky had in his system when he died.
Okay.
And ask her to keep it off the books.
Off the books?
Just do it. I got a preliminary report back from pathology, and there was evidence Paul Kaminsky had high levels of epinephrine in his blood when he died.
So?
So, I'm not sure he died purely of natural causes, and I need you to help me understand what happened.
Understand? What? Are you accusing me of something?
We pushed 1 amp of epi when he coded, right? April, I found 4 empty amps altogether in the trash afterwards. I can't seem to account for the other 3.
Maybe another patient coded in that room right before Kaminsky.
Nothing was locked.
Maybe they forgot to log it. I don't see what this has to do with me.
You were in Kaminsky's room just before he crashed.
You think I killed him?
I'm just trying to understand how so much epinephrine got into his system.
I don't believe this.
April, please, just tell me what you were doing in that room.
He was dehydrated. I gave him a glass of water.
So suddenly you're Florence Nightingale to this guy?
I think we're done.
April, please. You gotta be straight with me. I'm trying to protect you from getting in any trouble here.
Really? Because that's not what it feels like you're trying to do.
Heads up, Choi. We're reviewing the Kaminsky case for tomorrow's M&M.
Okay.
I see you didn't put down a cause of death yet. Something holding that up, or is that just an oversight?
Sorry, I just need to check something first.
I need your John Hancock before the end of the shift.
You'll have it.
Well, if something caused this guy's epinephrine levels to spike, it's gonna be on the adrenals, but I'm not seeing anything.
Could you give them a closer look? Something's gotta be there, I know it.
I'm not supposed to be doing this without a formal inquiry.
I know. Believe me. You're doing me a huge favor, Nina.
You're gonna owe me for this one. All right, let's see. Well, I'll be darned. Huh. Look.
I can't see anything.
There's your culprit. Looks like a pheochromocytoma. It's too small to show up on the scans. Must have been what caused the high levels of epinephrine in this guy's system.
So he died purely of natural causes?
Sure did.
Thank you. You're the best.
What's this?
This is what killed Paul Kaminsky, an adrenal tumor.
Okay.
I am so sorry, April. That was wrong with me.
No kidding.
If I'm being honest with myself, I think I was hurt. They didn't trust me enough to read me in. And then I started to mistrust you as well, and...
Well, maybe I shouldn't have cut you out.